Hello and welcome. My name is Carissa Luckett. I'll be sharing with you today from the Center for Youth Wellness. We're going to be talking about how to help patients and families dealing with adverse childhood experiences and a little bit about toxic stress, the science of ACEs, and just communicating about ACEs. The Center for Youth Wellness was actually founded in 2012 by Dr. Nadine Burke Harris, our first and current Surgeon General of the state of California. And the Center for Youth Wellness really hopes to lead the conversation on adverse childhood experiences and dealing with toxic stress through screening, interventions, and building resilience. We partner with the Bayview Child Health Center in the Bayview Hunters Point area of San Francisco, and provide direct behavioral health services after they screen patients through their medical clinic. And we also work with an ecosystem model. Oh, Lordy. Okay, I'm going to do that slide over. Okay, a little bit about the Center for Youth Wellness. We were founded in 2012 by Dr. Nadine Burke Harris, our first and current Surgeon General of the state of California. Dr. Burke Harris really started the Center for Youth Wellness to lead the conversation on addressing adverse childhood experiences and toxic stress through screening, interventions, and building resilience. We also partner with the Bayview Child Health Medical Clinic to provide direct behavioral health services for those individuals living in the Bayview Hunters Point area of San Francisco. And we also work to provide training and partnership on an ecosystem model that helps to build resources and strengthen families throughout the community. So this model looks like training for providers, which we're delighted to be doing here with you today, helping to build families, strengthen their resources and community linkages, and then engage communities in advocating for better health services, um, fighting against systemic racism, and partnering for policy change. As I said, I'm Carissa Luckett. I'm a nurse and a social worker. I'm here to talk to you a little bit today about ACEs science and the rationale for screening. I'm coming to you from Dallas, Texas, and I'm delighted to be with you. So as we get started, I'd just like to remind you that ACEs are very common. About 25% of Americans have at least one ACE. And if you think about what we've all experienced in the past little over a year with COVID, we know that universally, at least 25% of us have two ACEs if you consider COVID and the pandemic, and another 22% would have two ACEs plus the COVID experience, so three. And so we know that it's important to understand what adverse childhood experiences are and how they can affect your body and your mind as you go through life. So the original 10 core ACEs that were studied in the Folletti and Ondas report back in 1997 looked at three categories of adverse experiences: those that are abuse, both physical, emotional, and sexual, neglect, physical and emotional, and items of household instability. In the original study, they identified mental illness within the household, having an incarcerated relative, mothers treated violently. We now discuss this in the form of domestic abuse or partner abuse, substance abuse in the home, and divorce. And today we like to recognize that divorce is not the only item of household instability with regard to partner relationships. So we often talk about partner separation. There are additional adversities that were identified through the American Academy of Pediatrics, research on social determinants of health, as well as several community-based partnerships that provided um, an assessment of additional adversities experienced within their communities and have been validated through many other studies. And those items are now represented on the PEARLS and ACE-Q questionnaire in the bottom section, which we'll talk a little bit more about shortly. But they include community or school violence, experiencing racism, social injustice, and discrimination, homelessness or home housing instability, food instability, and separation from family. And this is specifically related to foster care, immigration, or deportation, having a caregiver or the child themselves having a serious physical illness, and caregiver death. In addition to that, we know that individuals experience adversity and communities experience adversity. And this wonderful study by Ellis and partners in 2017 really looks at a framework for addressing both. And this is partly why we like to address adverse childhood experiences and community experiences through our ecosystem model and not just at the individual level. Again, we know ACEs are very common, and about 13% of individuals experience 4 or more studies. And this is important because we see the change in lifelong health outcomes change significantly with 4 or more ACEs. And this is just a snapshot of what the experience is in California. And so by this slide, you can see again that 62% of Californians have experienced 1 or more ACEs, and 16% have experienced 4 or more. In 2020, Dr. Burke Harris produced and submitted the first Surgeon General's report on ACEs, and she identified in this white paper, some communities that are disproportionately affected by ACEs. And so I offer this up for your consideration as you think about screening in your clinics, to think about families certainly that may be having much more marginalized experiences in livelihood. And so individuals who are Black, Latinx, Native American, or multiracial, those who are high school non-graduates or unemployed or unable to work, certainly populations in lower income brackets, the uninsured or underinsured, people involved in the justice system, both adult and juvenile, women, and those individuals identifying as lesbian, gay, or bisexual. All again are disproportionately affected by ACEs. When we go back to that original Folletti study, we can see that of the top 10 leading causes of death in the United States, 7 of those top 10 causes of death are correlated with 4 or more ACEs. And so by this graph, you can see that if you have experienced 4 or more ACEs, you are 2 times more likely to have heart disease. You're almost 2 times more likely to have diabetes. And very sadly, this is a hard number for me to put my head around, but 30 times more likely to die from suicide. And when you look at these leading causes of death, we know that without intervention, there can be as much as a 20-year difference in life expectancy for those individuals who have had 4 or more ACEs and those who have not. The good news is Having 4 or more ACEs is not the end of the story, and it does not predict your life course. We can build resilience and build hope. And so we'll talk more about that a little bit later. There is also a dose response associated with ACEs and in childhood and adolescence. And so we know that in key areas of growth and development, having an onset of ACEs can be more toxic for the child or individual than when they're in areas of their lifespan where they're not having those significant child development and milestone. So in early childhood, if there's an onset of ACEs, we can see growth delay, cognitive delay, and sleep disruption. In the school age years, we can see onset of asthma, higher infection rates, learning difficulties, and behavioral problems. And in the teen years, we oftentimes see obesity, violence, bullying, smoking, teen paternity. And we really need to look at and consider the biological mechanism for toxic stress when we talk about ACEs, because it really helps to clarify what's going on in the mind body, and how systems can become dysregulated and become chronically dysregulated. So we know with adverse experiences, there can be a chronic triggering of the cascade of inflammatory and um, uh, other critical hormones that disrupt the neuroendocrine and immune systems. And we can see metabolic issues, reproductive issues, neurological and psychiatric issues. And then from that inflammatory cascade, the immune and cardiovascular issues that can eventually, if chronically dysregulated, create epigenetic changes throughout the lifespan. And so it's important for us to really think about what we're doing when we're screening for ACEs. And while many people think we're looking for those exact adversities that one may experience, what we're really doing when screening for ACEs is looking for the risk of toxic stress. And we know toxic stress is a prolonged activation of the stress response system that disrupts the development in the brain architecture, as well as those neuroendocrine systems that really increases the risk for stress-related disease and cognitive impairment well into the adult years. So here is a copy of the Pearls tool, and I just add this to the set of slides for you to really think about as you work towards implementing screening within your clinics and just becoming more comfortable with talking about ACEs, for you to look at a Pearls tool and maybe even fill it out for yourself and think about some of the experiences you've had. Please note that we encourage you to do this in a setting where you can get some support if you feel triggered. But with any screening tool, it's a good idea for you to read through it before you certainly ask your patients and families to read through it. So this is what we call a de-identified screening tool. It's not de-identified in that in the way that we normally think about it as medical providers. So we do ask patients and families to put their name on it, or certainly for you to have a system by which you can figure out which screening tool belongs to which patient or family. But what we mean by this is we don't ask specifically yes or no to each of the items on the screening tool. We just ask families to fill out and put the number of experiences they've had in this top section, which correlates to the 10 core ACEs in this box. And in the bottom section, we asked them to put the additional adversities that are more related to community adversities and social determinants of health in the box at the bottom. I mentioned to you that having 4 or more ACEs, or certainly having the experience of toxic stress, which can occur with any number of adversities within one's life, depending on how resilient they are and what types of supports they have, is not the end of the story. We know that these 7 items that we at the Center for Youth Wellness call the domains of wellness can actually buffer trauma and toxic stress and build resilience. And so these items are supportive relationships, and that actually is the item that has the strongest correlation to buffering trauma and building resilience. So having any supportive caregiver, doesn't have to be a parent, it might be someone in the community or a grandparent or an aunt, eating healthy or good nutrition, sleeping well or getting adequate rest, using movement or exercise, practicing mindfulness, supporting your own mental health or being mindful and treating mental health issues, and spending time in nature. So, again, all of these things build resilience and can be something that you talk about briefly as an intervention in the office, as part of your anticipatory guidance that you might already provide, and can really help patients and families focus on a strengths-based approach to becoming happier and healthier as they deal with adversity. This is one of my favorite slides that we share, and this is from the Alberta Family Wellness Organization in Canada. But I love this example of how negative experiences can be offset with positive supports and building resilience. And it's also important to realize that all individuals have a different genetic makeup that predisposes them to be more resilient or less resilient. So we need to keep in mind that some individuals may need more positive supports to offset their negative experiences, and some may need less. So it's important for ACEs screening to occur in a medical setting where you can help families determine how well they're building resilience and buffering that toxic stress within your setting, and provide them expert advice on how to become happier and healthier. Some key concepts we'd like to address with patients and families as we talk about this area of toxic stress is that ACEs are common, and that more ACEs we have means the greater chance of toxic stress we may experience. ACEs accumulate over time, so through our lifespan, our ACEs will go up. We can't actually unexperience something. ACEs with protective factors at those key developmental ages and stages can increase your risk of toxic stress, and that toxic stress can bring illness both physically and mentally. Now, I'm going back to Psychology 101 when I share this slide with Maslow's hierarchy of needs. And so I just share this with you because it's important for us to consider that if individuals are really struggling with some of these basic needs at the bottom, it's hard for them to build resilience. And so it's important to screen at all types of levels. And when you think about basic needs versus maybe some of the more psychological needs, it's really good to think about not only screening for the 10 core ACEs, but the additional adversities at the bottom of the PEARLS and ACE-Q questionnaires, because many times there are social needs that can be met by a social worker or a navigator, just putting families in touch with resources that they might need immediately. And that often can build some rapport or build the relationship that will allow you to talk about maybe some of the deeper needs that the family may be experiencing down the road. But showing your concern through screening is a very important thing. And we know from many studies that simply screening for ACEs, families see that as an intervention, just being able to talk about what they've experienced and having a caretaker or a provider show interest in their previous experiences helps them to feel more motivated to persevere and pursue resilience. And so I like to always talk briefly about motivational interviewing. That's a term you may have heard. I'm going to break it down very quickly, but basically, motivational interviewing is a collaborative conversational style where you look at an individual's strengths and motivate them, or um, navigate with them how they can commit to change. Basically, it's just meeting patient families where they are. So the framework that I'm going to walk you through with regard to motivational interviewing is called the OARS framework. And this is simply really using open-ended questions as you talk with families to elicit a little bit more information than a yes or no question. It gives you an opportunity to establish a safe environment, um, a trusting environment, and to explore or clarify what the patient's needs are. To use affirmations, and again, this is to build rapport and to build the patient's confidence and their self efficacy. Reflective listening to mirror what the patient says, rephrase what they're saying so that you can demonstrate that you're listening and you're trying to understand their situation. And then summarizing, which is always a good way to keep everyone on the same page and to close out a conversation with a plan of action. Just starting the conversation about ACEs can be hard. So it's important for you to practice. We'll be sharing some patient education materials with you that help families to understand what ACEs are. And this is actually one of those tools. But a good way to use a patient handout like this is to have a key phrase or two that you can use to let the family know why this piece of paper is important, and to help encourage them to read it as they go on about their day and leave the office. So oftentimes when I hand out this patient ed um, material, I say something like, when I first heard of ACEs, I didn't understand them. And why is it in the medical field we always have to have a fancy term for everything or an abbreviation? So ACEs are really just difficult or stressful times that we go through in our lives. And this handout gives some examples of what those are and why those could be harmful to you or your child's health. The second handout we'll be sharing with you is one on toxic stress, which I think is really great because in this handout, it helps to identify some of the ways that toxic stress can affect your health and may motivate individuals to really think about why it's important to address their ACEs so that they can be healthier, or to prevent toxic stress from significantly impacting their health. So, oftentimes with this handout, I say something like, having a lot of stress over a long time can make people sick. Do you think this could be happening in your family? I know I say often, I know when I'm going through a lot of stress, I have a lot of skin problems, my psoriasis flares up, or my face breaks out. And so it's important for me to know what I can do to prevent that type of toxic stress. And we really want to be able to help you do that as well. Some other conversation starters with regard to ACEs, particularly if they have four or more ACEs, or you feel like ACEs may be a significant issue in their lives, are to say something like, when you filled out this questionnaire, you marked that you've been through some really difficult things. And then don't forget to use the pregnant pause. Pausing when you're communicating with families really communicates empathy, and that you are not in a rush to talk about what's going on, that you want to listen. And it doesn't have to be very long. Even 3 seconds can be super helpful. So When you filled out this questionnaire, you marked that you've been through some significant or some really difficult times. Many people in our community have been through a lot. Can you tell me what is causing your family stress so that I can know how to help you the best way possible? Or you can start this off with an open ended question like, what is the most important thing that I can help you with today? Or is there anything you'd like to tell me about with regard to what you filled out on this questionnaire? Um, we would certainly ask you to take a break in a few moments and talk amongst yourselves. Do a little bit of a group exercise about other ways that you've opened up the conversation about ACEs and what has worked well. Oftentimes, I hear other colleagues um, opening pitch or how they talk to families about ACEs, and I get great tips. So as you engage with patients and families who may be having significant toxic stress, think about what you're going to do and how you're going to help them. And just remember that if the patient isn't receptive at the start, you can use handouts to talk to them about ACEs and toxic stress. And even if they aren't willing to take those patient handouts, just know that planting the seed that you, as part of the medical team, care about what they've experienced and that you see that as a significant thing that could affect their health and that you want to help them is planting a seed that may make them think about this a little bit further down the road, and it may make them more receptive as time goes by. And again, if the patient and family doesn't want to open up about what they're going through, you may even use the Maslow's hierarchy handout and just say, are you experiencing anything here in these bottom two sections with your safety or your shelter and well-being that we can help you with today? And don't forget to use that ORS framework. Certainly the open-ended questions, affirmations, reflective listening, and summarizing can be incredibly helpful in your discussions, no matter what you're talking about. Don't be afraid to ask what the patient is most concerned about. And if at all possible, if the patient family is willing to make a plan, say about getting better sleep or having a better bedtime routine, think about adding that to your after visit summary or giving them a handout on good sleep, writing down what they're going to try to do, having a set bedtime, maybe limiting screen time for 30 minutes. As families and individuals are 5 times more likely to follow through with a plan when it's written. So important for you to think about. I'd like to share a case study with you that is significant, and we see this happen time and time again in clinics. So as you think about how you hand out the ACE-Q or PEARLS tool to patient families, you also need to think about who is handing it out and the exchange of information that may occur before the provider comes in the room. So I share this example with you. Say you have an individual who has a mom who has a 3-year-old child, and they've come in the clinic. The MA has given them the ACE-Q to fill out or the PEARLS tool. And they come back in, and this is a mom that is known to the MA. They have great rapport, and the mom actually says to the medical assistant that she's really stressed out because her daughter has been sent home from preschool 3 times in the past 6 weeks for biting or other behavioral incidents. And the MA also knows that the little girl's been in several times for sick child visits related to stomach aches. Both of those items, stomach aches and behavioral issues, can be signs of toxic stress. And so it's really important for the medical assistant to hand off that information to the provider as they consider this score of 2 but also maybe some physical manifestations of toxic stress. May and that may trigger a different conversation with the patient family with regard to the impact that toxic stress may be having on that child. So just remember that every single individual member of the team has a role when it comes to screening for ACEs and toxic stress and helping patient families to heal and experience hope. I'd like to share just a couple of principles of trauma-informed care. I know you all have heard of this before and have been working on building your trauma-informed practice, but many of the principles that are critical to providing that trauma-informed practice or environment are listed here. And certainly safety is one of the key items. And so making sure that staff are trained or have a de-escalation plan with patient families that might be um, having some acute anxiety or conflict, even making sure we know how to deal with conflicts within the staff and how you can talk about those and resolve them. Trustworthiness and transparency, so making sure that you have a family-friendly office. Having peer support at work, so certainly um, making sure that patients and families have people that they can talk to in their community, and maybe having some examples of how they can get involved in that or talk to other families that may be experiencing what they are. And we need that ourselves as medical professionals, particularly when you've had an extremely rough couple of days, or as we've gone through this COVID pandemic, being able to talk to my medical colleagues about how COVID um, impacts us differently as providers than maybe non-medical providers, and just being able to support each other, lend an ear, and give each other some encouragement. Certainly collaboration and mutuality. That's why we talk about things like motivational interviewing, so that we really understand the voice of the family or the voice of the patient and what they would like to work on as far as building resilience. And then thinking about that even at a community level, where you might start a patient family experience committee or a community advisory committee. Empowerment and really making sure that families have a voice and a choice in their care is important, and certainly cultural, historical, and gender issues that may have occurred within your own community, how you can acknowledge those, but prevent re-traumatization is really key. And certainly we know from the literature that trauma-informed organizations work actively to realize the widespread impact of trauma and recognize the signs and symptoms, not only within the clients we serve and families, but also within our staff, that we respond fully by integrating practices of trauma-informed care within our policies and procedures, and that we actively resist re-traumatization. I also like to just add this as we think about how working with ACEs and talking about ACEs may be triggering to us as healthcare providers. I certainly would promote you taking care of yourselves so that you can continue to serve patients and families. And some of the best ways to do that are really to build your own awareness. So not only considering taking the Pearls or ACE-Q tool, filling it out for yourself, but being aware of your own body and mind experience, how you deal with stress, how you notice the effects of stress in your life, and what really makes you feel rejuvenated when it comes to self-care. Is walking in nature uh, more important to you than maybe spending time with friends, or cooking, eating healthy food? Just being aware of what helps you to feel self-care and regrowth. Certainly looking for balance within your work and life, your personal life, making sure that you have time to rest and relax, connecting with others. So, building the supportive relationships within your own life, we know certainly is the most expedited way to build self resilience. Thinking about debriefing again when you've had difficult times at work or different, maybe a very challenging patient family has come in. Just being able to talk to your colleagues for a moment and think about maybe what went really well with that patient family and what would we like to do differently next time they come in. And then keeping in mind your employee assistance program if you're starting to experience some symptoms of burnout or compassion fatigue. All of these are key in your journey to talk about and help families who are dealing with ACEs and toxic stress. We thank you so much for your time today and encourage you, if you have any questions, to um, partner with your leadership at your organization to send those to us, and we'll be happy to get back with you. We'll also be sharing resources that we've discussed today, as well as this presentation. And we wish you the very best of luck as you continue to serve patients and families within your organization. And I thank you for your time today. Um, it means a great deal of us that you're committed to buffering toxic stress and building resilience. And we wish you the very best in your journey. Thank you.